Hello and welcome to Ask the Oncologist. My name is Dr. Kpatsi. I'm a clinical oncologist. I will be bringing you a series on the prostate gland and specifically prostate cancer. I'm going to divide it into different parts, so stay tuned and don't forget to always click on this channel and then learn a lot from us. Now, what is the prostate? Now, the prostate is a gland that is located in the pelvis of a man. Women don't have a prostate gland. It sits just below the urinary bladder and then in front of the rectum. It's about the size of a walnut as shown in this picture, and the dimensions is about 3 by 4 by 2 centimeters. And it plays a very important role in men. One of them is that it produces about 20 to 30% of semen. And then secondly, it also regulates the flow of urine in a man such that it can either restrict the flow of urine or freely allow a man to be able to pass urine anytime he feels like. Because urine from the bladder has to flow through a part of the prostate that we call the prostatic urethra before it goes down to the penis and then comes outside. So you can see that the prostate gland is very important in a man. However, the prostate gland can develop cancer just like any other part of the body can. And then it happens to be a very common cause of morbidity and mortality in men. In fact, worldwide, prostate cancer is one of the commonest cancers among men. In the Western world, it's only second to skin cancer, whereas in Africa and in Ghana, it still stands out as one of the commonest cancers. In Ghana, it's the second commonest cancer, second only to liver cancer. According to the available data, in the year 2022, there were over 2,000 men that were diagnosed of prostate cancer in Ghana alone. Ghana alone lost over 1,000 men to prostate cancer in the year 2022. So why should men care about prostate cancer? Because it's one of the commonest cancers in men. And another key thing to know is that the risk for developing prostate cancer increases as a man grows older. It is worth to know that men who are of African ancestry have a higher risk of developing prostate cancer. More so, prostate cancer in men from this ancestry tend to be more aggressive and tend to have poorer prognosis compared to prostate cancer from other parts of the world. Now, it's also important to know that early diagnosis of prostate cancer saves lives, reduces the intensity of the treatment, and saves a lot of money, and it saves you a lot of morbidity at the end of the day. And if a man cares about his prostate health, it means he gets to live longer and live a more healthy life without having much to worry about as he grows older into his 70s and 80s. So in the next episode, I'll be discussing with you the major risk factors that are involved in the development of prostate cancer. Thank you very much for making time. Don't forget to subscribe, share the link, and share it with a friend. Let them learn, let them educate themselves, and let the men know that prostate cancer is real, and then early diagnosis saves lives and saves them a lot of stress and allows them to live longer into their old age and enjoy their lives. Thank you for making time.